Good morning, everyone. My name is Tarin. I am one of the knowledge and research leads here at CICMH, the Center for Innovation in Campus Mental Health. Welcome to our June webinar on developing a mental health strategy on campus. We're joined here by our great speakers, Jennifer Thannhauser and Dr. Andrew Szeto. Sorry, Jennifer, I mean Dr. Jennifer Thannhauser. And before we begin this great presentation, I would like to do our land acknowledgement. So I know that we are joining here today virtually, but we are all joining in from ancestral lands of many Indigenous communities. I am currently in Toronto, Treaty 13 territory, and the home of the Anishinaabe, Haudenosaunee, Wendat peoples, the Mississaugas of the Credit, the Chippewa, and people who may still be unrecorded. As a settler myself, it is my duty to acknowledge the effects of colonialism that we still see today and the ways that I may be participating in it, as well as the ways that I can actively push back against it. So folks, if you would also pay attention to the screen here, I've laid out our housekeeping. So there is closed captioning available at the bottom of your screen. If you hit the closed caption button and turn on translation, set your speaking language to English. And if you would like to have your closed captions in French, you can set that as well. And that should automatically appear at the bottom of your screen once you have completed those settings. The chat function is available to share your thoughts, have reactions, but if you would like to ask questions, our Q&A function is available and you can submit questions there and we will be able to see it. The question period will occur at the end and the recording will be available on our website at the end of the day. So without further ado, I will just turn it over to our speakers. I will stop sharing my screen now so that you can go ahead and share your screen on your end.
Awesome, thank you. Always a pleasure to speak or partner with the Center for Innovation for Campus Mental Health. I'm just going to share my screen here. Hopefully you can all see that. So again, I'm very happy to be here. Happy to speak a little bit about our new community mental health and well-being strategy. You can see the title from development to, we'll give you some aspects of development, and Jennifer particularly will talk a little bit about the evaluation component. So my name is Andrew Szeto. I'm the director of our campus mental health strategy, community mental health and well-being strategy, and I've been in this position since 2016. So I've been doing this for a little bit now. Oh, I've also forwarded our presentation into the future. I see it says 2025, but it's actually 2024. But I'll leave it at that. Jennifer, can you introduce yourself?
Yeah, thanks, Andrew. I'm Jennifer Thannhauser. I am a counselor in student wellness services and also part-time evaluation lead with the new community mental health and well-being strategy. I've been at the U of C since about 2013 in student counseling. So that's been the focus of my career, and now starting to make a bit more of a transition into the research and evaluation. Thanks, Andrew.
Awesome. So first we'll do our land acknowledgement as well. Jennifer?
Yeah. So Taryn, thank you for doing a land acknowledgement for where you are. We would also like to acknowledge where Andrew and I are located. And so we're at the University of Calgary, which is located in the heart of southern Alberta. And we acknowledge and pay tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. And the city of Calgary is also home to Métis Nation of Alberta, Districts 5 and 6. And we feel incredibly privileged to be able to learn, play, and grow together in a good way on this land.
Thanks, Jennifer. Today, as I kind of noted already, today we'll talk a little bit about our community mental health and well-being strategy. But before we do that, I just want to give you a little bit of a quick history on our campus mental health strategy, which you can see was in action between 2015 and 2024. Then we'll talk a little bit about the journey towards creating and the development of our community mental health and well-being strategy. We'll talk a little bit about particularly focus on the things that we've heard in our consultations and data and focus groups and all that, the things that we did to listen to our campus community, and also some of the emerging themes in the research. But just to give you a foreshadow, there's lots of concurrent coherence between all those aspects that we're seeing, what we heard, and between the research that we're seeing and the research that we're doing. We'll give you a quick glimpse of our community mental health and wellbeing strategy that we just had approved by our Board of Governors last month. And then we'll talk quickly about, or Jennifer will talk a little bit about the evaluation of our community mental health and wellbeing strategy. So let's get started. And as I mentioned, we'll do a little bit about background. So our campus mental health strategy, which was launched in December 2015, it was developed with a task force, mental health task force that was created by our provost at the time in early 2015. So it took us about a year to develop the campus mental health strategy. I was fortunate enough to be on that task force, and Jennifer was on that task force as well. So we're very privileged that we get to start the work long time ago, I think almost 10 years ago, and we're continuing this work and developing a new strategy for U Calgary. But again, just some quick highlights of this strategy. You can see the model there. We have 6 strategic focus areas with 28 recommendations embedded within the 6 strategic focus areas. We do take a whole campus approach in the sense that our whole campus community is included in the campus mental health strategy. So students, faculty, staff. Over the years, we've really actually expanded who we work with beyond to alumni, to campus community partners, and we're trying to expand that as we move forward with the strategy, national partners as well. So it's a whole campus approach in a couple of senses. So I talked about our whole campus community, U Calgary community is included, but it also really looks at various levels. So if you go around clockwise on the 6 strategic focus areas, if you start at the orange, the orange and the kind of the avocado color pillar is really focused on the individual level. So things like raising awareness, stigma reduction, resilience, skills. If you move around clockwise to kind of the red to the kind of the butternut squash color, they're really focused on supports and services. So whether that be counseling for students or services like EFAP for faculty and staff, they're really those 2 pillars there. And if you move around clockwise to the last 2 pillars, those are really addressing kind of the bigger pieces on campus. So things like the environment, culture, physical environment, things like policies, processes, and procedures. So we had that breadth, with this campus mental health strategy. In addition to that, we also created an implementation committee. That committee did meet from 2016 to 2024. We're currently paused for some reasons I'll talk about later in the talk. But that committee met for once every 6 weeks for approximately 8 years. So that was a really strong committee that helped support the strategy and help identify priorities and the course for the campus mental health strategy. We did have it at subcommittees, so evaluation, teaching and learning, comms, programs, and again, we're as a kind of a foreshadowing, we are changing that up. So again, I talked a little bit about our model for our campus mental health strategy. Again, 6 strategic focus areas, 20 recommendations, and some of these address some of these recommendations that I mentioned across our campus mental health strategy. So we did develop, one of our recommendations was to develop a 4-credit resilience course. So actually we went beyond that and we created a embedded certificate which is the largest embedded certificate on our campus. For those who may not be familiar with what an embedded certificate is, it's basically a certificate you can do alongside your current courses or your program. It's composed of 3 core courses. So a course focused on self-care, Psych 203, and 2 other courses, WELL 300 and WELL 400. WELL 300 is focused on intersections and supporting others. And the last course, WELL 400, is focused on it's a capstone. So they people and our students in this course work with community partners to address a well-being problem within the organization. So it's really developing those skills to be champions in the community. So we have that as one example of something that came from our campus mental health strategy. We created a suicide awareness and prevention framework, which we have a great committee that's still doing the work and helping move this stuff forward on our campus. We were active during COVID. We did some research and created resources for our campus. Also, YouFlourish has been something that's existed, actually predated our strategy in a form of a wellness fair. But YouFlourish is really one of our flagship events that happens every year during November. We have so this is an old graphic. It's from 2020, but we're at approximately 25,000 participants a year now. So it's 2 weeks really focused on well-being, mental health, and how do we develop skills? How do we, have fun? So it's really spreads across all those aspects. And again, we have approximately 50 events or so. We engage the whole CAPS community. So it's a really, really successful event for us for the campus mental health strategy. Collaborations for change. I hinted at our collaborations with national partners, and this is with BPNet. So they've been a great partner. We held this conference in 2021. We held it last year in August 2023. So we're starting to plan for next conference in 2025. Our website on the last graphic there is a very, very important piece of what we do on campus. Lots of resources, lots of we have our all our resources and things are on there. So including things like mindfulness podcasts that we've created. We have our resources both from student wellness as well as our other resources. But also it's a really great way for us to get our messages across and stories across. And I just want to share. We've been doing a lot of campaigns and stigma reduction, and these stories do live on our website. I just want to show you one quick story.
I struggled with addiction for many years throughout university. I was constantly around party culture, and because drinking was so normalized in my circles and even blacking out, it wasn't seen as problematic. Everyone kind of says this quote, but the opposite of addiction is connection. Alcohol was really the currency for belonging, which is something that I really craved, and soon realized that I had a problem. The shame, the guilt, I'm not going to do it again. And then doing it again, the loss of control, I just could not seem to stop. And fast forward, moving to Calgary in 2017, I was in recovery for 5 years and found that the stigma associated with being in recovery was greater than the stigma associated with being in active addiction. I was advised that I shouldn't tell anybody I was in recovery because it would affect my job prospects. And I had worked really hard to get where I was. So decided that I would stay in the closet, even though it was really killing me. This got increasingly unmanageable to the point where I was prepared to leave my tenure track position. I ended up meeting with my dean, who was very supportive, and that eventually led to embarking on a program of research looking at addiction stigma, specifically amongst faculty members. This eventually led to applying for a grant to launch a recovery community on campus. The University of Calgary recovery community has been going on ever since. I think people can drink in safety, that's great, but a lot of people can't, or a lot of people want to change their relationship with substances and they don't have necessarily the tools to do that. but they have a community on campus and they have people who they can go to who get it. It's really just about helping people. And the UCRC aims to support multiple pathways of recovery, to build community, and to reduce stigma on campus for faculty, students, and staff.
So that's one of the stories that's highlighted on our website, and you can see many other stories from different campus community members, so faculty, staff, students. So we have various campus community members talking about their stories. So really that stigma reduction and awareness piece. But another reason why I showed this clip was so Victoria, she's the founder of UCRC. And actually Recovery on Campus Alberta as well now. But you know, recovery and harm reduction on our campus was a gap. And it was a gap in our campus mental health strategy. There was one specific, so out of the 20 recommendations I talked about, there was one specific recommendation focused on alcohol, and that's it. That's all we had, right? So, this highlights our campus mental health strategy was a strategy. It's a great strategy, and I really, because I worked on it for a long time and supported and implemented it. It's a great strategy, but it had its gaps, right? It was the strategy of its time in 2015. Things have changed. So we really needed to think about revising, renewing our campus mental health strategy. So I try to be super fancy on this slide, but I don't know if it might have made the text a little bit hard to read. But that said, I talked about the gaps in our campus mental health strategy. Also, our strategies on our campus tend to run in a 5-year cycle as well. So it was about time to renew our strategy in 2020, but that said, things happened in 2020, which nobody expected. So things got delayed. But we really wanted to, again, engage in the renewal process and start to really generate something that was reflective of our campus community. So our first step, I would say, in our renewal process or journey to renewal, and this actually is a picture of Norway. Actually, it's a path, but what you don't see is the path that goes up the mountain. And so our journey was fairly defined, but yet it also had it wasn't too many turns or twists, a lot of, but it was a steady climb. There was a lot of work that we had to do, so that kind of signifies our journey. But our journey and our process really started with an external review of our campus mental health strategy back in late 2021. So we wrote up a self-study. We invited campus mental health experts, whether they be counselors or people who are doing research in this area. So we had a group of 5 individuals, if I remember correctly. They reviewed our strategy. They looked through our documents. They talked with those who were on our campus, implementers, campus community members, and they wrote a report. And that report, said we were doing a lot of great things, but yet there were also things that we can improve on and move forward with a new strategy. So we did a lot of, so again, that was our official starting point, but we've also been listening throughout throughout our strategy. So particularly within the last 2 or 3 years or so, we've been doing a lot of surveys. So we conducted the CCWS. We also did the NCHA in the previous iteration and previous years. We also did a graduate mental health and well-being survey. We did a bunch of consultations for the national standards for both actually the workplace and for the post-secondary standard. Last year we did a faculty and staff survey as well. So those are some of the pieces of information. We reviewed all those. We reviewed some fundamental documents for post-secondary mental health as well. This was done by our evaluation team. So Jennifer leads our evaluation team, but they're composed of grad students from faculties in our at U Calgary. They looked at the data, they summarized it, they generated themes, which were very important for identifying what were our priorities, should be our focus areas for a new strategy. And one important piece that I want to mention is our Elders Leadership Circle for Sustainability and Campus Mental Health. Our sustainability strategy, our institutional sustainability strategy, is kind of on the same course in renewal as well. So they developed a new action plan that recently just got approved. But they're on a similar time frame as we were. So we thought we really had to work with our elders on our campus and beyond that. So we created a elder circle with Treaty 7 and Treaty 6 elders, and we talked with them for over a year. So we're still talking with them. We were still engaged. This relationship continues on, but we listened to the stories. We listened to their advice, and a lot of what they said was very profound and helped guide us with our community mental health and well-being strategy. And a lot of what they've said is embedded within the focus areas of our strategy. So that's kind of our journey, or bits and pieces of our journey, or part of our journey. I'll talk a little bit about other aspects now. So once the evaluation team generated these themes, we had an external consultants come in and have them look at the data to really give an outside perspective on all the things, because I think sometimes it takes a fresh set of eyes to look to see maybe we're missing things, but they really helped us out, and they reviewed our themes. They reviewed some of the surveys and data as well. They did a couple of important things. First of all, actually, they validated our campus mental health strategy. So our existing strategy was still relevant, and we're still doing things, and we should still be doing things to support some of the things in there as well. They also generated broad themes for us. So they created a set of 5 or 6 themes that they thought would be very important based on all the data that we had, based on the themes that we generated. So again, just giving it another set of eyes and another way of thinking about things. So we received their broad themes, and then we worked to create a draft strategy. So I do want to acknowledge the renewal team. So Jennifer was a part of the renewal team. We also had Michelle Moon, who is a part of staff wellness. We had Kevin Weens, who is a part of student wellness services, and Sasha Lavoie, who is my comms person for the strategy. So the renewal team worked and created a draft strategy. What we did was we really wanted to go on a roadshow and shop this around. We engaged in approximately 40 to 50 consultations all across campus with various units, with various groups, the Students Union or Students Legislative Council, graduate students, HR, various departments across campus. We also recognize that we can't reach everybody, but we want to reach as many people as possible on our campus and do it in different ways. So we devised, kind of a drop-in approach as well. We developed, so this is, you see the pictures there, that's a TFDL, so our Tailored Digital Family Library. And we set up stations there. We set up about 5 engagements all across campus, and we gave out snacks, coffee, and had people generate their thoughts and ideas across our guiding principles. We also created a survey where we had our draft strategy. People could, if they couldn't come to engagements, they weren't a part of our consultations, or if people needed to just sit down and think about it, they can go through the survey. So we did all this in I would say fall last year and early this year. We started, so based on all that feedback, we got through these consultations, drop-in engagements, surveys. We finalized our document. Our community mental health and well-being strategy is the new name of our new strategy. And we went through the governance process. It started in January. We had 8 meetings, so we went through various subcommittees of our General Faculties Council and our Board of Governors, and it was finally approved at the 8th meeting on May 24th. We were somewhat surprised by its reception. It was fairly well received. There wasn't too many changes. It sounded like they really liked our approach and what we put into the strategy. And so I'll get to the main thrust of our strategy here. And before I get to that, I just want to talk a little bit about what we've learned over the 8 years or so implementing our previous strategy. So we learned that, we have to take a university approach, right? Given our small capacity, we're most effective working across the university, doing things like campaigns, working with faculty. So a strength of ours was collaboration. We developed so many partners through the years and worked with so many great partners like student wellness, staff wellness, and faculties and departments on our campus. And then we also had to take kind of a network model in the sense that, we held some of the expertise, but yet we couldn't, work with every single person. We didn't, and we can't do, we're not frontline as well. So what we did best was to work with our collaborators and distribute, whether it be our resources or knowledge in that sense. So that kind of grounds where our learnings come from as well. So this is what we learned through our consultations, working with our elders. We heard from our campus that we need to take a holistic approach. Mental health is important and will always be important on our campus, but we have to take a holistic approach. So well-being essentially. So we have to address things like our spiritual well-being, right? We heard that from our elders. We have to address our spiritual well-being. We have to address our physical well-being, our physical health. We have to address things like social connections. We found out in the past several years that social connection is such an important piece and impacts our well-being a lot, right? So go beyond mental health and address all those aspects that impact our well-being. A second thing we've heard from our campus community is that, yes, services are important, right? We always have to have counseling. We always have to have things like EFAP, but we have to emphasize and shift our work upstream. As a strategy, as a holistic campus approach, we really have to emphasize health promotion, mental health promotion, and illness prevention. The more upstream work we do, the less downstream work we have to do. And finally, third thing we heard from our campus community is that we have to start shifting our academic and workplace culture. We are a campus that has goals to strive to achieve, which is great. There's nothing wrong with that. But if we can do it in a caring, kind, supportive environment, the more I think we can achieve. So it's really, really understanding those pieces. And we also heard from the elders that relationships are important, right? Our relationship with each other is important. Our relationship with the community is important. And as well, the relationship with our land is so important as well. We can't have well-being if our relationships are not in proper order. So that's what we've heard from our campus community and from our elders. So this is the main thrust of our strategy. I won't go into too much, but these are just some of the themes that we heard from our consultations across campus. Again, increase awareness about well-being and mental health on our campus across our whole campus community. Thinking about teaching and learning and how do we integrate that? And that has been a thrust for us in our past strategy, and it continues to be a thrust for our community mental health and well-being strategy. Create an environment that's respected, valued, and secure and safe. Again, social connectedness in our community is another important piece, right? What the elders mentioned. Civilian interact from our staff and faculty survey was a big theme. From our graduate mental health survey, student supervisor relationships, right, are important. So again, those big cultural pieces, the social connection relationship pieces are important as well. And so those are, again, some of the themes, but I'll hand it over to Jennifer to talk about some of the emerging research as well.
Thanks, Andrew. So I'm just going to share some high-level key themes or points that have been emerging in research in the area of post-secondary mental health and well-being. I'm really going to, again, not go into details of the research itself, but focusing in on the key themes that came out of this research. And you'll notice, hopefully, close alignment between what's being seen in the research and the themes that were emerging out of the consultations that we've engaged in at the University of Calgary that led to the renewal of the strategy. So the first study I want to highlight is one that I actually led in collaboration with Andrew and some other colleagues at the University of Calgary. And so specifically, we were exploring students' perceptions of resilience. And so we did a survey with kind of the broad student population. And then we also did focus groups with marginalized or underrepresented students. And so there's a few major themes that I wanted to highlight. And so the first is that students talked a lot about resilience being a shared responsibility between individuals and systems. So they recognized that there were individual skills that were important to support resilience, However, they really did need those supportive relationships within the post-secondary community to really be able to enact or enable the resilience within the post-secondary context. Second major theme is around kind of this transition from culture of competition to culture of collaboration. And so we did hear a lot of concern for students around a culture of competition that is strong within the post-secondary context, and students perceived as a barrier to resilience. And so there really was a strong call for a culture of collaboration and relationships where students' full selves, inclusive of their multiple roles and responsibilities, can be acknowledged and valued. Finally, students called for responsive institutions. And students identified that, so there's some frustration that there needed to be resilience in the first place, and called on institutions to be able to identify and remove unnecessary barriers where they do exist. So while students acknowledge that resilience is an important part to their ability to thrive going through life, there's still recognition that there could be opportunities to remove barriers that impede well-being in the post-secondary context. Another study I'd like to highlight for a moment is by Foulkes and Andrews, and they presented a really interesting hypothesis entitled the prevalence inflation hypothesis. And they were kind of doing this, or developed this hypothesis. They were considering the mental health crisis that has often been talked about in the post-secondary literature. And so there's this awareness that mental health stigma reduction efforts are really important, and that is helps to increase individuals' interest in reaching out for support, being able to identify where there are concerns. But they also suggest that it could be contributing to rise in mental health problems. That is, there might be some unanticipated outcomes that have come from the anti-stigma efforts that have been made. And so they talked about kind of two pathways or two contributing factors to this increase in mental health problems. One is a positive one in terms of improved recognition. So it refers to how awareness efforts may be leading to better recognition and more accurate reporting of mental health problems. However, they also identify what might be the other side of the coin, or is this issue of overinterpretation, which refers to how awareness efforts may be leading people to misinterpret milder and more transient forms of distress as mental health problems. So I think this has important implications for how we think about anti-stigma initiatives within our strategy, and also it emphasizes the importance of taking a holistic developmental approach to mental health and well-being. And if you want to go to the next slide. And Mark Doris comes out of the UK, and he's been doing quite a bit of research over the years related to healthy campuses and work related to the Okanagan Charter as well. So there's just two studies here that I wanted to highlight for you. So the first study on the left from 2020, Doris was doing qualitative research looking into how a whole university approach was conceptualized. And some of the key themes that emerged out of this research was, first and foremost, a supportive culture and environment. And so recognizing that for a whole campus approach, we really need to focus on the culture of the organization and how this culture ensures that working, learning, and living environments support health, well-being, sustainability, and community connectedness. Second is being able to focus on the whole population. So often strategies or universities, institutions will focus on students or staff. And so recognizing that we need to be able to look at everybody within the post-secondary community. So really taking that both and approach. And then the third is being able to pay attention to integrating health and well-being into every activity of an institution. So thinking about our facilities, our environments, our support services, curriculum, and research. And so a whole university approach really needs to take that holistic approach and be embedded in all things that universities or post-secondary institutions are involved in. The second study is more focused on the role of leaders and really emphasized the importance of effective leaders in being able to drive forward these whole campus approaches to mental health. And so one of the things that they emphasize, it's not about the personality of the leader, but it is about their character, how they engage the institution, their emotional intelligence, and their commitment to a health and well-being agenda and their understanding of it. And how important it is for senior leaders in particular to really be able to drive home those messages around how to act and how to engage with health and well-being within an institution. And it sort of also involves engaging or modeling those commitments. Next slide, Andrew. Thanks. And the final study I just want to highlight comes from Bacchys and colleagues. And this is a really interesting article that examines the crisis narrative in the post-secondary mental health context. So they recognize the need of increased attention to student mental health while also examining those unintended harmful consequences that I mentioned earlier. And we need to be able to have a balanced perspective on both of these. And so Bacchys and colleagues call for what's called a balanced public health approach to post-secondary mental health. And so this approach seeks to restore the balance between mental illness and distress and normative developmental processes. So a balanced public health approach to student wellness explicitly acknowledges that mental health is shaped by a range of risk and resilience factors spanning the biopsychosocial spectrum. It also recognizes that there is some suffering that's involved in negotiating typical developmental tasks of emerging adulthood. So I've included a photo of Jenga here. And so it's kind of like when we think about navigating a post-secondary context, there's going to be some challenges and there are going to be some things that are off balance. And yet with sufficient supports and resources, right, we can also enable students to be able to navigate through those challenges. And this is partly why we need to call for, again, a campus-wide interventions to address the social and contextual determinants of well-being. Go ahead, Andrew.
But I might unmute myself. So hopefully, we've painted a picture, through our consultations, through the research, that there is coherence between those, and that it's really addressing things like, or taking a whole campus approach, taking a more upstream approach, addressing things like culture, addressing our relationships. So all of these pieces went into the community mental health and wellbeing strategy. As I mentioned, this is our step forward for the next 5 years or so. It did, again, just approved exactly almost a month ago in May 2014. I do want to say we went with a little bit of a slightly different approach. We don't have specific recommendations. We have guiding principles and core components. So guiding principles are basically our general values or general aims or goals. Our core components are some specific actions that we want to achieve under these guiding principles. And then we have some examples of things that we are doing currently, have done, and want to do in the future. These things will fluctuate based on the needs of our campus community. So we built this in a way so that's flexible and responsive to our campus community, rather than being locked in to specific recommendations that may hold true at one point in time, but may cease to be useful as time progresses. So this is kind of a schematic of our new strategy. This doesn't look super awesome, but we're working with our graphics and marketing department to create a better graphic. But basically, you see the socio-ecological model. People are familiar with that, or should be familiar with that. The interconnected circles. But we have our 4 guiding principles mapping on to the 4 levels. So guiding principle 1 is really focused at the cultural and environmental level. Guiding principle 2 is focused on kind of the meso level, so working with faculties, departments, and teams and classroom settings. So really working with those leaders, especially at that meso level. The third guiding principle is at the interpersonal level, really focused on how do we support ourselves, but more importantly, how do we support others? And at the individual level, it is kind of the final concentric circle, and that's where guiding principle 4 lands. I'm going to show you the 4 guiding principles and the core components and examples. These are very text-filled slides, or it's not the simplest 3 because there's lots going on here. I'm not going to go over them too much. You can go see our news strategy at the URL at the bottom there. So ucalgary.ca/mental health/strategy/renewal, or if you just go to our strategy page or mental health strategy page, ucalgary.ca/mental health, you're going to see everything there. So I'm going to go quickly. I'll just give you a kind of a hint and some flavors of that. So the guiding principle 1 again is broad level, right? To create a sustainable, positive change in mental health and well-being landscape of the UCalgary through prioritizing a holistic approach to creating sustainable, supportive environments for all campus communities. So things like evidence-based and evidence-informed frameworks, like the national standards, for both standards. One thing actually we've been criticized on is working with researchers, and because we're a research-intensive university, we really need to focus on addressing research and the culture of research on our campus. So, so again, this is guiding principle 1, working at the broad cultural level. Guiding principle 2 is, again, focused on the kind of meso level, so really working with units, faculties, and departments to create that psychologically safe and well-being enhancing environments, right, for everybody so they can flourish. So working with, again, faculties and units to adopt the strategy is maybe one approach. Things like our embedded certificate. So again, you can see the core components there, some examples. I won't dwell on this too long, and I'll move on to guiding principle number 3. So this is, again, really focused on creating those skills to support ourselves, but more importantly, to support others on our campus. So again, really that interpersonal relationships. So again, you can see some of the things that we have here that address those things and the core components there, enhanced literacy, trainings available for our campus community. And finally, guiding principle 4 is really at that individual level. Again, I mentioned that we're not a frontline, we're not frontline services. We are limited capacity. So there's essentially 2.5 or 3 of us that work on the strategy. So we don't have capacity to create those supports, but we do have capacity to work at the broad university level. So we do create awareness of the great resources that we offer on campus and off campus. We do stigma reduction awareness campaigns. So that's within our scope and capabilities. So that's our 4th guiding principle. Finally, I just want to get into a little bit about what we're doing now and where we're moving next. So we're going to formally launch this at UFlourish. I mentioned UFlourish in one of the beginning slides. It continues to exist and is, again, a big part of what we do on our campus. So we're going to launch it there. I mentioned the piece about the research, and one criticism of our old strategy was that, we're a research-intensive university, so why not really think about research? So we have, Jennifer is also leading our post-secondary research and knowledge hub. We've engaged researchers, clinicians, people who are doing in student services about post-secondary mental health as a priority, as a research priority on our campus. We've had a couple of events. We've received the internal grant on our campus to really work through this and create this research hub. So that's something that's to look forward to. We're currently developing our plans here. We're gonna, for the first year, we want to think about a couple of priorities. We also want to, within the first year, create our long-term 4-5-year plan. We're revising our structure, so I hinted at that, right? We had our implementation committee. So we've tried to reconfigure differently and really focusing on leadership as well as one of the main groups that we interact with, as mentioned in some of the research and our consultations. Evaluation plan is another thing that we're currently creating. What we didn't do appropriately in our previous strategy was to really address evaluation, have that underway before implementation. So I'm just going to hand it over to Jennifer to talk about this last slide here on evaluation.
Thanks, Andrew. So just want to really highlight on a high level kind of our initial thinking around evaluation. As Andrew mentioned, we are kind of in the development phase of our evaluation plan. But we recognize that what the strategy is trying to do is implement essentially social change, and we're working within very complex and dynamic systems. And for that reason, it requires an evaluation approach that's really flexible and dynamic as well. And so in this approach, we are choosing to use a principles-focused evaluation. And so principles-focused evaluation focuses specifically on evaluating kind of the meaningfulness and quality of those guiding principles, looking at the adherence to those principles. So that is, to what extent are the principles being implemented and how are they being implemented? And then also looking at impact. So to what extent do the principles contribute to desired outcomes? And so I guess what this approach is really looking to do is help to identify what are those specific pathways that are leading to the desired changes that we're hoping to see as a result of the work of the strategy. And so for that reason, we will use mixed methods, including both surveys and qualitative kind of interviews and focus groups, document reviews, etc. We do intend to continue to use measurements at population level, so looking still at using the CCWS, a similar kind of survey with staff as well, so we can continue to monitor overall mental health and well-being within our community. We also are committed to engaging in continuous measurement, reflection, and improvement. So one of the goals of principles-focused evaluation is really to be iterative and continuing to inform the development and the revision of the strategy over the coming years. So those are some of the kind of the key focuses. Well, one other thing I wanted to mention is that we also are committed to annual community feedback. And so we will providing data back to the community on an annual basis, letting them know a little bit more about the progress that the strategy is making. So maybe I'll leave it there for now, Andrew, so we have some time for questions, and certainly can provide more details on evaluation as needed.
Thanks, Jennifer. So I want to thank everybody for coming to our webinar, and to those who will view this in recorded form. Hopefully we've given you a sense of kind of where we've been at and where we're our development process of our community mental health wellbeing strategy, what we're doing next, and some evaluation pieces. Hopefully that's helpful for those who are in the process or going through their strategy development or whatever, right? So yeah, thanks once again. Thank you for us, and our website is there and our emails are there as well. I'll stop sharing.
Wonderful. Thanks so much, Andrew and Jennifer. If folks have any questions, you can start putting them in the Q&A function. In the meantime, maybe I'll ask a question. What is, I guess, if you could give maybe 3 pieces of advice for anybody who's going through this process, what are the key advices that you would provide?
So maybe I can start. I think, we may have different ones, Jennifer and I, but, some things that I do have thoughts on is this process takes time, right? And you're not going to get it done in one day. We're a small but mighty team. We were realistic in the sense that we created opportunities to really engage with the campus community, but within our capacity, right? We couldn't survey every single person. We couldn't talk to every single person, but we made it a priority to really, get a diverse campus, go through the diverse campus engagements with various groups, and try to meet people where they're at, right? Whether with different means, so whether it be surveys, walk-in engagements, specific consultations. So to really be mindful and plan, and really speak to everybody on campus as much as possible within your capacity. So that's one piece of advice for me. I don't know, Jennifer, if you had other pieces.
You highlighted the one that was first to my mind as well, is taking that time to listen to the community, so that the strategy can really be aligned with what the needs are. And Andrew, I think also emphasized the importance of having a strategy that can be flexible to kind of changing context, because the mental health context is constantly changing and evolving. Our social cultural context is changing and evolving. So we need to have strategies that can be flexible and dynamic. And then evaluation, I think I would add, in terms of being able to integrate that from the very beginning and thinking about how we are evaluating the work so that, again, it can feed back into and inform the ongoing work of the strategy.
Yeah, and again, I just, Jennifer, you're so right, and these things take time, right? We engaged the elders, a year in advance, and we continue to hold these relationships and continue to engage them. So again, those are maybe those are all related, but I think you can pick up a couple of pieces there, a piece of advice there.
Thank you so much. We have a few questions in our Q&A function here. So the first question is, can you speak to what has been accomplished and what is envisioned to be part of the social change you hope to influence going forward when it comes to policies and the approach to policy development?
So that's a good question. Policies is something that's very specific on our campus, and it's something that's developed by legal services. Long time ago, back in 2016, I created those relationships with our legal services to really think about the policies that are made on our campus. And specifically, as policies were being generated or created, we had an agreement where we would work with them to really think about things through a mental health lens. Thinking about a couple of policies like student academic misconduct, things like appeals processes. So we review those regularly. We're asked to review those. And when new policies are being created, for example, things like our cannabis policy, when in 2018, when cannabis became legal, we created a policy, and it's working with them, right? We're at the table in developing those policies. So really, I think some of those are important pieces that we've laid the foundations for. What I think we need to move forward on is to engage the faculties, the units, to think about their own policies, processes, and procedures, and to think about that through the mental health lens. We are, again, limited in capacity, so we can work at the university level, but we can't work with every single department unit and faculty to do that. So it's really giving them the skills to think about their policies through a mental health lens. So I think in doing that, I think we can shift our culture.
Thank you for that. Another question here. Has there been consideration for making mental health literacy courses mandatory for all first-year students across all faculties?
Yeah, that's a tricky question. Making things mandatory isn't well received on many campuses. I know it's done in the States a little bit. I know there's some little bit of work in that here. I think good teaching pedagogy and good teaching and learning suggests that making things mandatory isn't the best to engage people. That said, I've floated this idea around, and it'd be great if all students could learn about the great resources that we have on campus, learn a little foundational things about mental health, and to learn about our other strategies, our Indigenous strategy, our sustainability strategy, to learn about our EDIA strategy, right? I think those are very important things that all university students coming into our campus should do and should know, right? Now, I think a way to get around this is to really have these contextualized to the faculties and departments. So really, having students that take this within. So if it's an engineering student going into the engineering faculty, they create this course that's geared towards engineering, so it's relevant, and they see the relevance for them rather than having a generic course. I think that might be an approach that might be a good way forward, a good compromise, maybe.
Thank you. And Jennifer, let me know if you ever want to jump in. Another question here. You spoke about the strategy being supported by governance, but you had some mixed reception. I'm wondering if you could share any of the challenges you experienced with governance.
So actually, I think I mentioned that we're surprised that it went through relatively smoothly. People were really interested in or down with, so to speak, our approach. So taking an upstream approach, taking a holistic look at this rather than straight mental health. and then really addressing the culture on our campus, both academic and workplace culture. So they were really interested in that. But they also had some thoughts on, don't forget about EDIA, things like that. Don't forget to really think about how do we do this with leaders and the importance of leadership in driving this. So those are a couple of pieces of feedback that they had. And also to really, so one thing we did find was going through the process in the governance process, our consultations, there is still a lack of understanding of maybe the scope of post-secondary mental health services on campus, what we can do on our campus. There's a misunderstanding maybe, or a lack of awareness and knowledge of even the resources that we have on campus. So those things still came to light for us through our consultations and going through the governance process. Again, I don't know if there's anything else that you wanted to add there, Jennifer, that came out through the consultation that might add to what I'm saying.
Yeah, I think the one other theme, again, being the evaluation lead, I think a lot about evaluation, but it was certainly reiterated through all of our consultations going through the governance process about the importance of having evaluation embedded throughout. We had lots of questions around metrics and how we are measuring. And so I think it's just a continual reminder of the importance of having that evaluation process embedded throughout the work of developing and carrying out the work of a strategy, and being able to report that data back to the community so they have a better understanding of what it is that we are doing and how we're doing it and the change that it makes.
Yeah, thanks for that. And I think my only point to add to that is I think there is some education pieces for us to talk about what principal focused evaluation is, and that evaluation is more than just KPIs. And there's different ways of doing evaluation, and there's different approaches, including mixed methods, so including quantitative and qualitative.
Wonderful. And then final question, as a follow-up, is there a particular tool or toolkit for policy development from a mental health lens, or is it more complex, nuanced, and contextually that these conversations should happen?
So toolkits for looking through policies through a mental health lens, there isn't super lots of resources on that, if I understand correctly. I know the standard has a compendium chapter that talks about thinking about policies through a mental health lens. I actually know that because I helped write that chapter. So that's available through the standards CSA website. So that's one resource, but there isn't really that many resources. I'm sorry to say that, but maybe somebody with that knowledge should work on that. Maybe that's a call for other people to work on that.
100%. I do want to let folks know that we did compile a list of mental health strategy across Ontario that are done by other campuses. We have made a list, and if you would like to access that, we put the link in the chat just to get an idea about what other schools are doing. However, right now we are at the end of the webinar. Thank you so much again, Jennifer and Andrew, for coming here and providing great insight on your process. And folks, if you would like to watch this webinar later, or if you'd like to send it out, we will have the recording up on our website. I will put the link again of our website as well as the webinar section in the chat. And if you are able to fill out our evaluation survey that will pop up at the end of this webinar, feel free to fill that out. We would like to hear your thoughts. And yeah, I hope you all have a great rest of the day. And we are looking forward to seeing you folks again back in September, because we are off for webinars in July and August. So I hope you all have a great day. Again, thank you so much, Jennifer and Andrew.
Thanks for having us.